You're watching Let's Chat.
We are continuing our observance of February being Heart Month, and this is Cardiac Rehab Week. Joining us to talk about that from CHI Memorial, it is Matt Thomas. Matt is the manager of the Cardiac Rehab program at CHI Memorial. Matt, good to see you first of all, and thanks for joining us.
Happy to be here. Thanks for having me.
Tell us exactly what is involved in cardiac rehab. Once you get that news, you need cardiac rehab. What are the steps involved?
Yeah, absolutely. So we have two levels of care, but the most traditional pathway for cardiac rehab is to have a heart event. So you come to the hospital with a heart attack or maybe a pre-planned surgery. And after that, that's where we step in with cardiac rehab to help people get used to maybe a new diagnosis, making the lifestyle changes that they need, and taking them through a monitored exercise program that's really targeted at getting them back to where they were before the event happened. So most people come with a referral from their doctor, but our second phase of care is to support people who have had heart disease in the past and might need a little bit of a refresher, so to speak, and we have some services targeted to that as well.
So there are different phases involved in the cardiac rehabilitation program, correct?
Yes, so we call them phase 2 and phase 3. So phase 2 is our insurance reimbursed and referred program. That's right after maybe a heart surgery, where we really get down to the fundamentals of making sure that the heart can heal and getting people back to the things that they need to do and they want to do. Phase 3 kind of comes after that program if you need some sustained opportunities to exercise in a monitored setting just to keep up the safety. And that can go on kind of on a self-pay basis for as long as our members want to participate here with us.
And I've heard it said before that once you start cardiac rehab, it's not something that you do for 6 weeks, 2 months, a year, or whatever. It's something you pretty much do from that point all the way on to the rest of your life.
Yeah, and that's actually a great point, and that really is our focus. While we work with patients anywhere from maybe 4 to 12 weeks in our formal programs, really what we're trying to do is to educate and give them the tools that they can carry forward for the lifespan. You know, our mantra here is that exercise is medicine. Well, if you stop taking the medicine, then you'll stop getting the response. So we really try to give people the tools that they need to carry that through and better understand why they need to exercise and make some of the lifestyle changes that we promote in the program.
I know this next question may sound kind of strange, or the answer being self-obvious, but tell us how doing and participating actively in the cardiac rehab program leads to better health.
Yeah, absolutely. Well, you know, a lot of people kind of find themselves out of an exercise routine by the time they have a heart event. So whether they're dealing with other conditions or other challenges or risk factors, we would say, like maybe diabetes or being overweight, high blood pressure, etc., exercise is a primary treatment for every one of those things that can contribute to heart disease. So while our focus is really secondary prevention, getting people back into a condition where they can take on and improve their quality of life, again, for those things they need and want to do, we're also working on those risk factors to bring those risk factors down and minimize the chance of having a future event. So it's a little bit of a kind of a twofold approach, treatment and prevention.
Matt, we got to leave it there. Thanks so much for spending a few minutes with us. Again, we are celebrating all month long. It is Heart Month, and this is Cardiac Rehab Week. Find out more about Matt Thomas and the great stuff they are doing at CHI Memorial. You can find out more by checking out the website, memorial.org. That is memorial.org.